patient. So we walked the patient journey. It was actually the first challenge before we could walk the journey was finding the patients. There was no code for MSCC, there was no knowledge about how many patients they'd had with MSCC or with suspected MSCC. No real understanding of this cohort of patients at all. It is a condition that can affect non-cancer patients. There was no understanding of how many were cancer patients, how many were non-cancer patients. The acute medical staff had very little information at their hands about what to do if they had these patients. District Macmillan nurse, and she'd been working with a patient out in the community and actually suspected MSCC herself. She tried to refer that patient into the hospital, and no one in the hospital wanted to know anything about it. No one would accept the patient and no one would acknowledge her concerns. For 5 days she visited that patient every day, watching the patient deteriorate. She spoke to her own hospital trust, acute medical teams, oncologists. She spoke to 2 different treatment centres to try to get advice and help for this patient, and actually hit a brick wall at every step. There was no guidelines, there were no processes there to help her, to help this patient. Eventually the patient was accepted in, was assessed, was MRI scanned and found to have MSCC, but unfortunately too late for anything to be done about it. The patient had his information card and realised that it was very similar to the symptoms that he was experiencing himself. So when his community nurse came to visit him, he shared his concerns with her. She rang through to the MSCC coordinator, the AOS nurse in the hospital, and she agreed that the patient should come in urgently and be directly admitted to our acute medical unit, which she organised. By the time the patient had come in, the MRI was already booked. He was in an MRI within an hour and he was in the treatment centre having his treatment that afternoon. So, within kind of 14 hours of the patient even making contact, he'd actually been in, had his scan, had his diagnosis and started his first round of treatment. And that's phenomenal turnaround to what we were seeing previously.